So KP, I know these surgeries can be very painful, and through the years I've seen that pain control after surgery was the biggest challenge to the surgeons. And of late I've noticed that the anesthetists are getting really involved in controlling the pain. A lot of pain control methods have improved over the years. But I've noticed, particularly here, after you started with us, that the patients are going home within 24 hours, and this is not something that I've seen before. So how are we different from other hospitals where modern methods do exist, but the patients take a little longer to get home?
Right. What we have, first important thing is we are involving the patient in the pain management. That when the patient actually comes for the pre-anesthetic checkup, we actually sensitize them that having a look at them if they don't have any other problems, that you are good enough to stand after your operation.
Right.
If you stand, we are
prime
happy.
The patient.
Yes.
Yeah.
If you stand, we are happy. If you walk, we are extremely thrilled.
Right.
So it's a goal setting for the patient.
Correct.
That you set a goal that there is something to look forward to. And we tune the entire anesthetic process so that whatever prevents them from waking up and walking immediately after surgery, we do not do.
Excellent. Like nausea.
Nausea, we virtually stop
Nausea,
having
yes.
nausea and vomiting. We do not use drugs that induce vomiting. We see that they get adequate analgesia during surgery so that they don't remember the pain after the surgery. We see to it that they are well asleep because we monitor the anesthetic agent and the depth of anesthesia. We see that they are perfectly asleep and all vitals are perfectly monitored so that they are not waking up deficit in something.
Right.
So the
they
process
are awake,
yes,
bright awake.
Yes,
bright
bright, zing awake as we
Yeah.
call it, and street fit.
Yeah.
That they are good enough to stand up.
Right.
The preparation at the pre-anesthetic checkup is we filter out all the pre-operative reasons why they cannot walk. For example, somebody's had a mild heart problem, we fix it.
Right.
So that prevents them from being apprehensive and say, I've got a heart problem, maybe I won't be standing. We fix it so they are confident that they can actually
So
work.
involving the patient before surgery in
Absolutely.
their pain management
Involving
is
the
probably
patient.
the key, really.
Yes.
Setting goals.
Finding time,
Yeah.
taking time
Yes.
with the patient, spending time with the pre-anesthetic checkup, involving the other specialities as well as the surgeon.
Yes.
That this is what we intend to do.
I think
This
this
is
is
the
what
point.
people forget to do, that here is a patient who's actually going through the surgery
Yes.
and is going to have all sorts of emotions in him or her, and then to put them at ease, to involve them in their management, I think is the key, really.
Putting
for
the
them.
decision. For example, there might be patients who might say, look, I don't want to stand after surgery.
Yes.
We have to respect it. Encourage them but not force them. So there are hardly any patients who say, I don't want to stand. They're all enthusiastic.
They're all like a challenge, really.
Yes, it's a challenge. You set a goal.
Yeah.
There's always, the pain relief has always been a goal. For Michael, it was, a goal setting was you should stand. The next goal setting was sit up. Next goal setting is to walk, then go home. There was something to look forward to, aim for.
Correct.
That is the key of any pain management or entire program. In the West, they have given it a name called Enhanced Recovery After Surgery, called ERAS. The whole idea of ERAS is that you do everything that prevents a patient from staying in the hospital. It could be pain, it could be nausea and vomiting, it could be a discomfort or an infection. You do everything to prevent it from happening.
That's right.
The pain relief was fantastic. In fact, I think your assistant came in the next day and asked me, on a scale of 0 to 10, what's your pain? So I told her, I said, it's 2. She says, don't be funny. I said, it's 2. I don't feel a pain at all. And I think that's the magic of the nerve block.
Yes.
See, and moreover is that what happened is that we have trained people to manage pain post-op. We have a pain nurse who regularly visits patients and sees that they get topped up for their pain relief before physiotherapy. The physiotherapists call us before pain relief, before doing a physiotherapy. So half an hour before that, we increase the pain relief so that the patient doesn't get disheartened that I got physiotherapy and I had felt pain.
Correct.
It's a negative step. So we time the analgesic before the physiotherapy. I think that's the advantage of being able to have sort of a boutique system in that we match the surgery, match the pain relief to that patient.
And that really makes a difference.
The
Involving
meshing
is the
of
key,
these,
involving
meshing of the
patient.
surgeons, the pain nurse, the physiotherapist, and the anesthetist and the surgeon.
It's what we call prehabilitation.
Prehab.
So the patient, nothing should be unexpected after surgery. I think the patient should be aware from day one what exactly is
I think
going
it's
to
a
happen.
combined team effort that produces this beautiful result.
Yeah.
And that's what's so superior about the
The-
experience that I personally had.
Well,
So-
fantastic.
At no point of time do we promise zero pain to anyone. I think that's a myth. You cannot have zero pain.
Yes.
The promise made is there will be pain, but we will make it tolerable to you.
Yes.
For example, you stub your toe, you don't take medications for it, you just tolerate it because it's within tolerable limits.
Correct. Yeah.
So similarly, we want to make this pain tolerable. That is our aim. If you can tolerate it, it's not pain. So if we can achieve goals, true goal setting for the patient, honest, true goal setting. It's very easy for me to say, well, you won't have any pain after surgery.
Yes.
There should be no pain during surgery.
Correct. Oh, of course.
That is the most important. The key is
I was completely out.
Yes.
The next thing I knew was that I was being wheeled out of the theatre, but I experienced zero pain during
Fantastic.
surgery. I never got up any time and felt
Yeah.
that something was happening to me. I think it was
And the other thing is
really
that
good.
we don't keep the patient fasting too long after surgery. We have tuned our anesthesia in such a way that the nothing by mouth after surgery duration is virtually nothing. So they don't wake up with a dry mouth, a sense of hunger, and generally having a heavy head in the mouth. They are light. We choose the right anesthetic agent so that they are bright awake, zing awake, and they are not hungry. So we see that their mouth is not dry. Anything that makes, the whole idea is to make them comfortable.
Yes. Make the whole journey tolerable
Yeah, absolutely.
and pain-free, basically.
It's a philosophy. The pain management, the knee is quite a complex joint of nerves. It doesn't involve one single nerve. So it is basically a whole, what we call as a multimodal management of pain. And to set their true expectations.
Correct.
They have been through a lot. They have not been walking for most probably a couple of years. They have been pain. They're waking up at night with pain. You ask them this question, are you waking up at night with pain? Yes.
Yes, they do.
That means they are not sleeping well. See, if they're not sleeping well, you're constantly irritable. You are not doing well at all. You're depressed.
Yes.
You have to address those issues before we promise them some sort of pain. You have to tailor the pain for that. There's enough of literature in this world that is being done.
Fantastic. I think that really is, and I can see the difference. Patients are doing so well, and it really encourages us to be more innovative in this aspect as well.
Absolutely.
Not, we are doing cutting edge surgery now, tailoring the operations to the patient, and the pain management. If that is not good, then all
The
our
whole
efforts
thing
are
falls
useless.
down in a heap.
So it's
I
a
mean,
team effort. Yeah.
If you're doing such great surgery, we have to keep the post-operative period as small, and the goal setting should be good. And so, in
It's a
fact,
smooth transition to
Yes.
recovery.
in
Yeah.
fact, we are actually seriously thinking that we should actually involve the pain management before the surgery so that their pre-operative few days are actually more comfortable, they sleep better, and
Yes.
they come less depressed, and
Yes.
they come for surgery, so that the goal setting becomes easier.
Correct. So simulate
The key is the pain management team. It is the anesthetist that we have, the pain nurse that we have, and that awareness that pain is not good. Pain prevents you from doing something.
Correct. Fantastic.
That's what we intend.
Great. Thank you, Kevin.